What are the symptoms of retinal vein occlusion? It depends whether it's the central retinal vein, so the main vein applying at the back of the eye, or whether it's a branch of that vein. It is associated with loss of vision, and often patients will wake up in the morning and find that they've got blurred vision in one eye. It is associated with people who have high blood pressure, which is not properly controlled, with diabetes, with smoking, so the usual risk factors for vascular disease. Not only can patients get reduction in vision, what they can also have is some of the complications of a retinal vein occlusion. This really applies to a central retinal vein occlusion, when new blood vessels form within the eye and cause the pressure to go up in the eye, or there is hemorrhage within the eye and possibly even retinal detachment. If the pressure goes up in the eye, it can be very painful, and so there's an eye which is not seeing well and also has discomfort. So if you have loss of vision in the eye, then it's important that you seek a consultation with your optometrist and then an ophthalmologist, and early treatment can be very effective in preventing the complications and occurring or restoring vision to that eye.